All right, welcome everyone. This is the Culture in Progress podcast for the Independent Women's Forum. I'm James Brohl, and my co-host is Patricia Patnode. And today we are fortunate enough to be joined by Professor Abigail Favale, who is a professor in the McGrath Institute of Church Life at the University of Notre Dame. She's also author of the recent book, Genesis of Gender, A Christian Theory. Thank you so much for joining us today, Professor.
Yeah, happy to be here.
I thought I'd kind of just jump into some tough questions since there was this recent school shooting in Nashville, which you've probably been following, where 6 people were killed. It was at a Christian school and the shooter was transgender, which raises a whole bunch of touchy topics. And so I guess my first question is, does it matter in this case that the criminal was transgender, or should we just be focusing on the crime and not worry about the gender identity of the suspect at all?
Well, yeah, that's actually a really good question. It matters, but it might matter less or in different ways than a lot of the media coverage, I think, has wanted it to matter. I've been trying to be a good girl during Lent, so I've been really staying off of social media. But after this happened, because I do write on the gender issue, I wanted to see what the conversation was like. So I kind of stuck my head in for a little bit, and I visited some transgender Reddit sites and then some gender critical sites just to kind of see how people were interpreting the event. And as you can imagine, it was so polarized, so hyperbolic, everyone immediately jumping to conclusions and also the worst possible apocalyptic interpretation of events. It's really fascinating to kind of be out of that and then suddenly stick your head into that kind of discourse and realize there's just so much pathological thinking on both sides that's happening, right? I guess I would say that, it is important to accurately report facts, especially as we seek to understand complex and troubling social phenomena such as school shootings. So I do think it is relevant if
There's even been debate about how to refer to the shooter, correct?
Yeah, there's been a ton of debate. And in fact, I guess a frustration I feel a little bit is that that's almost seemed more important than, right? Like there seems to almost be this hyper focus on how to refer to the shooter in terms of pronouns rather than some maybe much more important and pressing questions. And I think in some ways, this event has revealed the limits of our language or the problem with our attempts to kind of contort language to obscure certain realities. So it caused a lot of confusion, right? And I think it's also very important to use language in a very clear way, especially when reporting facts. So this whole situation provided kind of a fascinating case study there on how confused our language is and how preoccupied we are with that language rather than really just getting to a better understanding of what's actually going on.
Do you think there's anything to the claim that gender dysphoria and mental illness are connected, or are these just so stories? I mean, how do we distinguish between people who might have legitimate gender dysphoria, if there is such a thing, and those who need psychological care or even a threat to themselves or others?
Right. Yeah. So gender dysphoria is a relatively new term. So it replaced gender identity disorder in the latest edition of the DSM. And so gender dysphoria is kind of broadly defined as a sense of distress at one's own gender, right? And so if we think about that, there are so many different things that could be at work in someone feeling distress with their embodiment, right? So I think it's very hard to generalize about gender dysphoria because it's such a broad kind of canopy term. And you're exactly right. Like there could be a number of different reasons or other conditions that are connecting or creating this sense of distress. So I think it's actually really hard to disentangle. And it's a very broad brush, I guess I would say. because there could, for someone it could really be about social isolation. For someone else it could just be they've been totally immersed in this online environment that has kind of given them this obsessive focus on their body and how it's not fitting this ideal, right? Then you could have much more like serious mental health conditions that are somehow affecting a person's sense of gender, right? So you can't really generalize like this, which is why I think we need to be able to have a more complex engagement with gender dysphoria and in a more exploratory way on an individual level. Like, what is happening with this person, right? So I do think it's too simplistic to just say gender dysphoria is this, because gender dysphoria is like 10,000 things, basically, right? And so in some ways, I actually think it's not that helpful of a diagnostic term because it's so broad. And almost like if you look at the criteria, like in the DSM, it's almost it's hard to imagine an adolescent especially who would not fit the definition of gender dysphoria, right? Because it names such common experiences that someone going through puberty would have.
I was wondering if you could define the gender paradigm as like a term that you talk about in your book for the audience.
Sure, yeah. So in my book, I describe what I call the gender paradigm. And a paradigm in a basic sense is an interpretive framework. So it's a way of understanding reality and explaining reality. And so I make the argument that there is a certain paradigm that's emerged in our culture through which we interpret or come to certain interpretations about our experiences related to gender. And so some features of the gender paradigm are that what we know to be, what we think we know and what we presume to be real is more of a construct of society and language, right? So there's this sense of reality being linguistically constructed rather than something that is, there's like, say, I contrast it with what I call the Genesis paradigm, where there's a sense that reality has a givenness that is intelligible to us, right? So in the gender paradigm, there isn't this kind of intrinsic meaning to the world. Rather, it is the self who, through language and creativity, creates meaning. So basically, gender then is not something we receive from kind of the constraints and potential of our particular nature as male or female. It is instead almost like a project. Like gender becomes an avatar, right, or a profile that we're designing. And yeah, so that's kind of just a quick sort of overview, but I go into more detail in the book.
So there was a news story making the rounds on Twitter of a family that was raising their children without gender. And I've seen, especially on Snapchat, a lot of similar stories of families not wanting to raise their children with like a set identity of what their gender is. Do you think that kind of non-binary starting point is kind of the end goal of the gender paradigm that's in society right now?
I think the end goal is more of like a transhumanist end goal, I guess, to put it sort of extremely. I think that the end goal is limitless body modification according to someone's sense of self. So I don't think there's this like trajectory towards androgyny. I think there's this trajectory towards using technology to manifest one's individualized sense of gender. So that's that's how I would see it. And so this trend of like non-binary parenting, then it's almost like trying to create, like you want to raise your child as this blank slate, like this blank canvas, so that then they can realize through their capital S self what that canvas should look like, right? So that's kind of how I see this general trend going.
Do you think that's even possible? Or, I mean, we could, my sister, she has her daughter is in the blue room and her son is in the pink room, and they kind of mix things up. And I think that's kind of fun. But
Sure.
I mean, I don't know, to what extent is it even possible to raise a child without any sort of gender identity?
Oh, I think it's incredible. I would say that kind of parenting is basically like gaslighting, because I think that we have, as a species, we have evolved to have a very acute sense of perception about biological sex. We have evolved to really pick up on very subtle cues, and this happens like from day one, right? Like you can tell even babies, like babies respond differently to males than they do females. A lot of it has to do with voice, actually. That's something I noticed with all of my babies have gone through this phase as infants where male voices make them cry. Like they're just scary. So to then like take that small human being who is picking up on obvious differences that exist in a stable way in the real world, to then distort their perception to say like that's actually not a real category that you're perceiving, I think that's a form of gaslighting and almost like an abuse of perception, right? And this is something that children have to be taught from the outside because it's so obvious that there is such a thing as a boy and a girl, right? That's one of the almost the first differences, and the first difference they encounter just from the fact that sexual difference is the only way that new human beings come into existence, right? Obviously, technology is messing with that to a certain extent, but you still need two particular kinds of gametes to create a new human being. So I think the way we're playing with language, the way we're playing with technology, we're really trying to push back and undo this natural reality that children pick up on in an intuitive and instinctive way. So yes, I would say this is a manipulation or abuse of perception.
Another thorny issue that arises with children is this idea of consent, and are children able to consent, like for example, to a transition? Personally, I guess I get a little uncomfortable thinking about a 16-year-old or something, even someone that age, undergoing a transition, given its irreversible nature. And I did a lot of dumb things when I was 16 and probably regret them. But maybe, I don't know, in other ways, if you said, should 16-year-olds be allowed to vote? I don't think it's crazy. So I don't know how does this all fit into the equation?
Right. I mean, I think you gotta weigh the stakes of the decision. I think conventional wisdom says that there should be guardrails around adolescence for making decisions that will be life altering in a profound way, right? So that's why there are guardrails about drugs, alcohol, driving, voting. You can change your vote the next time the election rolls around, right? It's not going to shape the contours of your life in a way that are unalterable, right? So those kind of decisions, yes, there should be guardrails up for teenagers making those kinds of decisions when they're on this hormonal tsunami and their brains aren't fully developed and they are exhibiting more risk-seeking behavior. And it's just a very turbulent, unstable time of great change. And that is not the time when you want to be asking, a 16-year-old whether they might want to have, breastfeed their children in 10 years, right? That kind of forward thinking is just not a cognitive skill that's going to be super strong in adolescence. So yeah, we do need guardrails up.
Kind of the unawareness of like physical limitations and long-term effects. Because I'm 25, I went to public school. I didn't really understand like the science of my fertility, even though I have access to the internet, and I suppose I could have looked everything up. But the messaging that I got through school was that your fertility is a guaranteed thing. It's very easy to become pregnant. You should be on birth control as a default. That's what a doctor I had before I switched doctors was like. It is so easy to get pregnant, like all of the, like really almost selling very young people on birth control, even if they had no interest in having sex because of the absolute fear of their own fertility, which is not a guarantee, but that messaging that you can like flip switches in your body and you can turn things on and off, like functionality to me is it's really similar for like transgender, like puberty blockers and like voice changing. And and these procedures, as well as birth control for women. Do you think there's like a solid mirror there of how we
Oh
talk?
yeah, yes, absolutely. I think I would say like there's two things that I see that are really connecting, that are underscoring the connection you're making. One would be this kind of magical thinking about the body and thinking of the body as this malleable, almost liquid reality that can be pushed past its limits and without repercussions, right? That it's just this clay that we can kind of mold at will. And then also this pathologizing of normal physiological function, right? So that's happened, I think, on a sweeping scale when it comes to the normalization of contraception and what you're kind of describing there. Like, I would say most females have grown up with a situation like you're describing. We've grown up to see our fertility as something that's almost wrong with us, that requires medical management from a young age, and that is something that is dangerous, right? So it's a pathology, almost like all females are chronically ill because we have this innate fertility. And so here's this medical solution, right? Here's this exogenous hormones that can disrupt the normal functioning of your body, but that's framed as reproductive health, right? Which is really fascinating because that's a redefinition of what health means, rather than health being the right ordering and function of a particular physiological system. Health is defined as manipulating and disrupting the order of a physiological system in order to align with my will. And that's exactly what's happening with puberty blockers and cross-sex hormones. So with puberty blockers especially, now the rhetoric I see from proponents of that protocol is a pathologization of puberty. And this is explicit. Like if you look in the WPATH standards of care, there's this line that says to allow puberty to proceed can cause harm, right? So again, there's this pathologization of normal sexual development, right? And then of course, then there's a treatment for it, right? So then there's a technological intervention reframed as health that works by actually disrupting the endocrine system. So I really see the same kind of logic operating in both of those interventions.
So it sounds like there's a parallel maybe with mental health too, and the willingness to prescribe antidepressants and anti-anxiety medicine. It seems to me like that the doctors are very eager. You think that's different, or?
Well, so I think it's fuzzier because we don't really know how antidepressants work, right? So it's kind of like throwing spaghetti at the wall a little bit, right? Whereas we know exactly what the birth control pill is doing to a female reproductive system, right? Or we know exactly what Lupron is doing to a prepubescent endocrine system, right? So we know exactly what the intervention is doing in that particular system and why it's working the way that it does. So I can't say with as much confidence that a certain kind of anxiety or depression medication is it correcting something that's off, right? Is it, in other words, is it facilitating the order and function of the nervous system, or is it disrupting it, right? Because to me, I'm not as sure that there's a disruption going on as opposed to an attempt at having the system function as it should. Whereas with birth control and puberty blockers, the direct intent, it's not even a side effect, but the direct intent is to make the system malfunction, right?
They're kind of each troubling in their own way, I guess.
Oh yeah, no, yeah, they are for sure. Like it's been interesting that just recently I was doing more, this is kind of for a side issue, but I was doing more research about like antidepressants and medication for depression. And it was amazing to me, like how much of that is kind of this black box where it's like, there's a lot of kind of judging by effects, but not a lot of knowledge about exactly what's going on in terms of causes. And I mean, the brain, we just still our knowledge about the brain, I think is amazingly limited compared to how much we know about a lot of other things.
I mean, when I was a teenager, I can't tell you how many times I was told by people like depression, it's a chemical imbalance. It's just about correcting this
exactly.
imbalance. And
There you
then
go.
I've read stuff in the last couple of years that says, oh yeah, well, that was an idea in the 90s, and there's not really any evidence for that.
Exactly, right? But that's the narrative, right? So that narrative is appealing to, I guess, the standard understanding of what health means, is this like correcting an imbalance in a system, right? But we just don't know what that's happening. I guess a parallel, though, that I think is absolutely apt is this idea of medicalizing any kind of suffering, right? I mean, I think we live in this unprecedented historical moment where we live in many ways such luxurious lives that we can almost imagine or expect life without suffering. And so now we come up with all these sort of technological ways to manage suffering. And I think that's a problem, because I don't think we're, especially with children and adolescents, right? Because often it is during adolescence that you really encounter suffering for the first time in profound ways. And I think one of the things that's going wrong right now is adults are responding by wanting to rescue young people from that, rather than teaching them how to go through it, right? And how to actually become a functional adult, how to become human, how to become wise. There's so many, I feel like there's any ancient wisdom tradition, so much of its focus is about how do we learn to suffer well, and how do we learn to manage suffering. But it seems like we're living in a moment where we're much more concerned about escaping suffering at all costs. But ironically, that leads to more suffering.
So there's been a lot of talk about Ozempic and the potential for other weight loss drugs. Do you think that is another solutionism step towards alleviating suffering very quickly?
Yeah, well, I think this is actually another example of the kind of avatar, like the self-avatar phenomenon that I was talking about. And this is something that I try to remember to say when I give talks about this. Like when I talk about the gender paradigm, especially to young people, I'm like, it's not just people who identify as trans that are being shaped by this paradigm. Anyone, I think, who's on Instagram and trying to curate the like best self-image, right? I think one of the things that's happening in our culture right now is this attempt to take the liquidity of the online world into the real world. It's like, okay, on Instagram, I can express myself in this way that I feel so good about that visual expression of who I am, right? I've kind of airbrushed the things out that I don't want. Well, now we have these kind of technological interventions where we want to kind of curate the specific image or this avatar in the real world. So these extreme kind of weight loss drugs, body modifications, right? Like I think this is all part of the same phenomenon, even though it's manifesting in different ways.
I thought one of the most interesting part of your books was how you describe the evolution of your views over time. Could you talk a little bit about how your views on gender have changed over the course of your career, and similarly how your views about feminism have changed as well?
Yeah, yes. I believe pretty different things than my beliefs have changed pretty radically, right? So in some ways that's an advantage, because I can remember how I used to think, and I know that I wasn't crazy or evil when I thought those things, right? But I've just come to different understandings of anyway, things have changed my views. So when it comes to gender, I would say in my 20s, when I was in graduate school doing gender studies and feminist studies, I was really, for the most part, drinking the Kool-Aid about gender being a social construct, all of reality being a construct of language, and everything's a metaphor, right? This kind of like postmodern cloud of ambiguity coloring everything. And one of the things that pretty rapidly changed or disrupted that view, I guess, was becoming a mother. I think in some ways it's very easy, especially if you're in the laptop class and you're a young female in her 20s. I think it's very easy, again, to succumb to this magical thinking about embodiment. It's like I was on the pill, my fertility was suppressed. There was nothing about what I was doing that seemed sex specific, in terms of my occupation at the time, like as a graduate student. And so I think in that state, it's very easy to fall into the belief that sexual dimorphism isn't really a thing, and that men and women are basically interchangeable, or at least if we like, push a button here or turn off this here. And so becoming a mother and seeing the full potentiality that I possess as a female being activated was a very shocking experience. And also I became a mother to a son. So my first child is a son. And that also, I think, awakened a new curiosity in me about what boys experience in the world, what they go through, what kinds of burdens they experience as well. I think I had this kind of narrow focus on like women's dignity and justice for women in society, right? And so I think once I became a mother, I had a broader interest in what's good for boys and men too, and a desire to understand that better. So I think it opened my world up quite a bit. As far as specifics, like becoming a mother changed my view on abortion. I became Catholic around the age of 30, not long after I became a mother. And that through that process of wrestling for a good several years, my views about sexuality changed, contraception, and marriage, right? I had a theology of marriage in a way that I didn't, which all kind of goes back. You can kind of trace those changes back to moving away from this idea that men and women are basically interchangeable, to actually seeing that there is this sexual asymmetry and that it's very real and we have to take it seriously. Also, we shouldn't interpret it in these cartoonish ways, but pretending it doesn't exist is ultimately not going to lead to our well-being as individuals or as a society.
I've definitely had some similar experiences with my own children. So my first child was a girl, and there have been times when she's watching a cartoon or something, and she says something like, "Oh, that's a girl. She has long hair, or she has long eyelashes, or something like that." And it just or even like dropping her off at school. There's like she's 7, but there's middle school age girls, and some of them are like shaving their legs and stuff. And I'm just like, there just are things about our culture now that kind of bother me in a way that I just never thought about in these pressures that are applied to girls. And I think about all the money my wife spends on hairdressers or makeup and all that stuff. And I guess, yeah. So, I mean, I've gained some sympathy for the critics of our culture and the pressure that we place on women, which I don't think I appreciated before I was a father. And so I definitely have more sympathy for the view that like there is a lot about gender that is kind of made up, and that some of it may actually be harmful, probably a fair amount of it, especially when we see all the studies about social media and the influence of phones on young girls in particular. And I worry a lot about that. Like my daughter's not really looking at the internet that much these days, but she's already like on YouTube and stuff. So I don't know. I mean, I feel like it's not so simple as just saying the people who kind of want to tear down the gender structure are just these postmodernist sort of intellectuals with their heads in the clouds. Like I feel like they have a point there, but I'm not quite sure where to draw the line.
Yeah, I think you're exactly right. So I think the line to draw is to hold on to the distinction between, I guess, biology and culture, right? So there is real biological differences that exist, that every single human culture depends upon the existence of sexual difference, because that's how the species transmits itself, right? So in a way, it's the only universal difference, right? You can imagine there have been human cultures that have not had racial differences or ethnic differences, for example, but every single human culture has to navigate sexual difference because it's intrinsic to our species. Now, how that sexual difference is interpreted, that can vary from culture to culture. And we should be able to critique bad interpretations of sexual difference, right? We should be able to say, okay, female genital mutilation, that's not conducive to female flourishing, right? Or some of the things that even you're describing. But at the same time, the line where you cross, where you go too far, is to say that sexual difference itself is a cultural fabrication. And that's basically what the postmodernists say. Like, that's what Judith Butler says. So she says that there isn't this stable reality of sexual difference upon which cultural norms are placed. There are only the cultural norms, right? And so that's where I say that's too far. Okay, so we have to take human nature seriously and our sexuate nature as part of that. But at the same time, I think we should have very real and substantive conversations about how our culture interprets sexual difference.
You have this great line in the book. I wrote it down like in my book notebooks. I thought it was just very poetic. I saw a brief glimmer of light cut through the postmodern haze. I thought that was such a zinger. And then I was just wondering, have you seen like glimmers of light kind of in the past couple of years with how people just are talking about different newsworthy things, like more normal people or even students of yours?
That's a good question. I have wondered if maybe in terms, I guess I would say that around 2016 and on through 2020, maybe 2021 in the fall, teaching became very unpleasant. It was not fun to be in the college classroom because it suddenly became impossible to have real conversations. People were afraid to disagree with one another. And you would get in this dynamic where like one or two dominant personalities would just kind of hold the room emotionally hostage. And I am starting to wonder if maybe we've turned the corner a little bit, right? So I've been seeing some encouraging signs that maybe, I don't know if you want to call it like the cancel culture phenomenon has kind of maybe peaked in certain areas, and that we're seeing an easing up a little bit, a little more freedom, a little more willingness for people to engage, or people just being tired of that dynamic of, fear and not being able to have real conversations. Now, of course, there's still a lot of the more dysfunctional dynamics happening in our culture, especially online. It's especially on social media, right? You see such unhealthy conversations being modeled constantly. But I am encouraged. I am encouraged in the gender conversation specifically by what's happening in Europe, that you have, I think now we're up to 5 or 6 countries that are progressive countries, but they have been observing what's happening with their youth who've undergone medical transition. And they're seeing some problems, right? They're seeing osteoporosis, they're seeing high rates of detransition. And then in response, they've done systematic evidence reviews and then responded to that evidence by changing protocol. Like, that's how things should go, right? There should be some kind of oversight. Someone should be watching the evidence, and then treatment protocols should be responsive to that evidence. So I'm really hoping that eventually that will happen in the United States. It's trickier here because we don't have a centralized healthcare system. So we'll see what happens. But that is one piece of encouragement where it does seem like there still is a contingent of people who are like, no, this needs to be based on evidence, not on ideology.
What sort of policies in this area do you support, if any, or regulations of either transition therapy or even social media regulation?
Ideally, I think what's happening in other countries is that health advisory boards are conducting reviews and then changing guidelines and recommendations. And I think that's ideally how it should work. I guess I'm wary or skeptical of the heavy-handed kind of top-down bans on any kind of this sort of care or this sort of care, right? When those things aren't well defined, or well understood. And that just seems like, like taking a sledgehammer into surgery, like it's just not the right approach. I think on the state level, we're starting, like, for example, in Florida, their like health department did a systematic review, and then based on the conclusions of that, or they commissioned it, right? So someone else did it, I think at McMaster University. And then based on the results of that review, they decided that certain procedures wouldn't be covered by Medicare and things like that. So that seems like a better approach, to have advisory bodies that carry the responsibility of regulating healthcare in a specific state, to make evidence-based protocols, right? Rather than having very like partisan, polarized legislation battles. Because I think there's an authoritarian impulse there. And you see it on both sides, right? Because in like blue states, it's like so-called conversion therapy is banned, right? Well, what does that even mean in this context, right? Or in red states, it's like, no, any kind of like gender medicine for youth is banned, right? So those, I'm not a supporter of any of those kinds of bills that I've seen thus far.
Do you think it's strange that it's a lot of conservatives and conservative governors and administrations are very concerned, obviously, about youth transition and even those procedures for adults, but the youth thing is more of a tangible thing to go after. But even today, I don't hear anyone very concerned about the health complications that can come from breast implants, like for women, even though there's a lot of documented like increased cancer risks, and people get cancer all the time that may or may not be connected, or their lymph system gets affected. But that genre of surgery doesn't seem to have been altered, or like medical boards have taken an interest. So I wonder if you have thoughts on that, because I find that very strange, because it's also a gender modification connected to how we present ourselves to the world.
Right. So without kind of saying what, making any kind of like moral or ethical judgment about breast implants, for example, I would say there are several differences here in terms of youth gender transition being treated differently. One, it's not framed as an elective cosmetic surgery, right? It's being framed as necessary life-saving care, and therefore it should be subsidized. It should be covered by insurance, or it should be covered by the government. And that's not something that's happening with, breast implants, unless, I don't know, maybe in a situation where it's like reconstructive surgery in some cases. But even then, I don't know. So I would say that this is pushing that line, in other words, right? Like it would be different, and this is true for adults too. Like I think it would be better to categorize gender transition surgery in the elective cosmetic camp, right? That doesn't answer the question about whether it's ethical, but I do think that's just more appropriate categorization, right? And then we can have the discussion about like, what are the limits of ethics in cosmetic surgery, right? And again, that question about, is this restoring a body, or is this pushing the limits of a body in a way that is not about health? Okay, like that's like a legitimate conversation to have. And also the minors thing, right? Like I really think if this weren't being pushed on or offered to young people, if minors weren't getting double mastectomies, I don't think this would be as explosive as it is right now. So I think that's one reason why we're seeing the controversy here, where we're not seeing a controversy around boob jobs. Also, it's not controversial to sexualize women. That's like, as American as apple pie. So not that it's good. I'm not supporting that. I'm just describing.
We'll just do a couple more questions. Could you talk a little bit about what churches can do to welcome transgender individuals into their communities without sacrificing some of their beliefs, or how do they balance this?
Yeah, I think that's a great question. That's the question that I'm grappling with in my work right now. So the project I'm working on in my new position here at Notre Dame is a big piece of it is trying to come up with models of accompaniment for people who experience gender discordance. And I'm working in a Catholic context. So, in some ways it will, what a particular church teaches about human anthropology, about sexual difference, about sexuality, that will vary somewhat from context to context. But so I'm just beginning this work. So I don't have this like, here's the amazing formula or model I've worked out, but here are some initial thoughts, right? I think there needs to be a preservation of the perspective on reality and the human person that church offers, right? So that needs to be a priority, like that, because that's the whole point, the whole like reason of being for a church is that they have something to say about what's true and about what's real and about what human beings are made for. So that, in a Christian context like that truth of the gospel that needs to be preserved and it needs to be taught. At the same time, we're increasingly in our culture faced with a pretty wide chasm between, say, the ideals of a Christian community and how most people live their lives, right? And the whole point of the church is to meet people in the messiness of their lives and kind of help them along the way toward the ideal, right? So we have to continue teaching the ideal and speaking the ideal while also making room for a way of gradualism and a way of accompaniment as people over the course of an entire lifetime kind of fumble their way toward the truth and toward like deeper conversion and integration, right? So in some ways, this is really just about like getting back to the basics of like how to have a good relationship with another person, right? To be friendly, not to impose your views upon someone, to be curious about their circumstances. I think the rhetoric around trans stuff tends to paint trans people with a very broad brush. And in reality, I think I've never, every trans person I've met, every trans story I've heard is different. So I think taking a personalist approach, one that's very focused on the person and just getting to know the person, like who is this person? What do they like to do? Right. And then I think church communities should prioritize supporting the relationship between any individual and God and supporting that like spiritual growth rather than front loading the question of like gender and what they should do or not do, or whether they need to transition or detransition, blah, 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 blah. Like that should not be like priority number one there. It should really be about creating a deep connection or helping facilitate a deep connection between that person and Christ, and then kind of getting out of the way. That makes sense. So
yeah, that touches on my last question, which is what advice would you give to a Christian who's struggling with their own gender identity?
Oh, that is such a good question. I don't think I've ever been asked exactly that question before. I mean, it's hard to answer in the abstract, again, because I think one of the first things I would want to do is more deeply understand what exactly is the nature of that struggle, right? Because again, for someone, it might be based in trauma. For someone, it might be much more about a desire for community, right? So beginning to kind of untangle that. So I guess the first thing I would want to do is just to like really understand their story. And I guess I don't know about advice. I'm always reticent to give people advice, but I think my advice would be this huge like gender ball that's like taking up all the energy and sucking all the energy out of the room. Just like set it to the side for a minute and just like really try to develop a rich interior life of prayer and focus on that. And let the, just let the other thing be. Don't try to control it. Don't try to, just like focus on that, like developing prayer and putting everything into God, like literally surrendering everything into God's hands. Like this was part of my conversion experience, was like there, you know, I became Catholic when there were still, I had some big hangups with what the church teaches. But I got to this point where I was like, you know, where I basically was praying, I was just asking to be shaped by the truth. Like, show me what's true. I wasn't saying like, I wasn't praying that please change my beliefs to align with the Catholic Church, right? It wasn't like that. It wasn't, I also wasn't saying these are my beliefs and I'm not going to change them. I'm going to like hold them tight and not give them up. I was like, I want to live in the truth. Help me live in the truth. And so just that kind of open-ended prayer and then being open to what happens. I think that's probably would be my advice, but it would be more about like developing that rich relationship directly with Christ through prayer and not hyper focusing on the gender stuff.
Great. Well, thank you so much, Professor Favale. The book is Genesis of Gender, A Christian Theory. Everyone should go out and read it. It's a great book. Thank you so much for joining us. And
yeah, thank you. This was great.
Until
You
next
asked good
time.
questions.
Thanks.